Morning and welcome back to BCfm. It's Monday the 17th of October. It is 9 minutes past 9 in the morning. And it's Shona Gentry taking you through the morning today because Marcus Smith is away in America. I've got Tin Hinson on the news desk. Before the news, we had a very interesting update from an economist telling us all about an event you can go to tomorrow night at PRSC to learn more about economics and why the economy's been so strange recently. So do check that out if that's something you're interested in. We've got two more guests in the studio this morning on a different topic. Well, sort of related, but a bit different. So very interesting. Two guests from the Royal College of Nursing, two Bristol nurses, Emma Hallam and Lannery Amosu. Hello, guys. How are you?
Hello.
Good
morning.
Well,
yeah, good. Thank you.
Yeah, brilliant. And yeah, how's getting in this morning? You all good?
Yeah, we're all right.
Yeah, brilliant. So, yeah, tell us a bit about. I've seen something in the news about the Royal College of Nursing are doing a strike ballot. Is that right? Can you sort of tell us what's going on?
Yes, it will be the first national, across the four nations, in 106 years.
Oh, so out of England, Northern Ireland, Scotland and Wales, the first strike ballot?
Yes.
Oh, my goodness.
Yes. There was a strike in Northern Ireland in 2019, which was the first time that Royal College of Nursing's ever done. For years we said we wouldn't strike, but it's got to the point now where we feel that it's our only option is to withdraw our labour.
Right, so tell us what's made it get so bad? Like why, what sort of changed?
Well, it's about pay. In real terms, we've had a 20% pay cut since 2010. But what really upsets nurses is the levels of staffing on the ward. It's actually breaking our hearts that it's just not safe anymore. A lot of nurses have left the profession because of pay, but mostly because they're not able to provide the care that they would like to. Why we went into it.
And sort of why did you both go into it? I mean, you're both clearly, know your stuff, and you work in Bristol and sort of it, but it's not an easy job, sort of why did you both go into it?
I like caring for people, and I think it's just natural. Most nurses I've worked with, it's a natural thing. You have to like caring for people, and your reward is the satisfaction of knowing that you're making a difference to people's lives every day.
Yeah, absolutely. And what's been happening is that rewarding feeling and feeling that you're making a difference is not happening at the moment.
Yeah.
Okay. I mean, there'll be people who are saying, well, what about the patients? This is just nurses wanting more money for themselves. They went into this job knowing that, it's hard work. And what about the patients whose care is going to be affected? How will it be affected?
So a strike by nurses is going to look very, very different from a strike from maybe if you're thinking the RMT or with the railways. We would always ensure that the most vulnerable would be cared for. We have something called derogations, so areas such as ITU and ED and places like that will be covered, and we would always ensure that patients are safe, but we still need to kind of cause some disruption to services, because else it's no point striking. But it's a huge decision for nurses. This is a massive thing, and we quite organised people, so we will make sure that that patients are safe, and it's also up to the trust to ensure that they're safe. Yeah,
and so I suppose, but people will be like, well, what is this just about money? I mean, how is it sort of, but then you also hear stories of, nurses needing to go to food banks, and then you think, oh, surely that's exaggerated because they're, they get paid, they've got a steady job. I mean, what's your sort of experience about how it's affecting your colleagues or the people you work with?
For me, I think it's something the public needs to get behind the nurses on, because it's not just about money, it's about the collapse of the NHS. Nurses are leaving in huge numbers, and without nurses there is no NHS, and that's what people need to realise. Nurses are there 24/7. Doctors reduce in numbers overnight, but nurses are there 24/7 in huge numbers, and without the nurses the NHS will collapse in no time. So I can only urge the public to get behind nurses, because they are leaving in droves, because most of the time nurses are working overtime. Most nurses, whether they're junior, senior, middle grade, every nurse is working overtime to support their family. They've got childcare costs, they've got housing costs, they've got living crisis, and even before the cost of living crisis, nurses have always worked. If they're working 3 days a week on 12-hour shifts, sometimes they work another 2 or 3 days. So you've got nurses working 6-day shifts to support their family, and a lot are leaving the profession because it's just not worthwhile for their mental health, for supporting their families. It's not sustainable. So I can only urge the public, if they don't want the NHS to collapse, to get behind the nursing workforce.
It's also, it's got to the point where you've got to remember that we're the public too. There's a lot of us. We're just balloting the NHS. We've actually got 500,000 members. 300,000 we're balloting because they're on the NHS agenda for change. So that's a lot of people. There's also a lot of women. Our profession is 90. Our membership is 90% women, and they tend to be the people that, when you look at the economy, we spend because of our childcare responsibilities.
As in, like, we're the ones who are spending money in the local economy and supporting local businesses.
Yeah, exactly. So it's all, it's a cycle thing that to support local businesses.
So it's a gender equality issue as well, because there's a lot of, if this is a profession that mainly looks after is worked by women, but then women aren't getting. We know there's a pay gap generally in society anyway. Yeah,
and even amongst the health sector, there seems to be this gender gap too.
So is that something that you say to somebody who's thinking, maybe we can't afford to pay nurses anymore or something? Is like what's the answer to that argument? It would obviously cost the government a lot of money to give a pay increase that matched inflation.
It depends where your priorities are, aren't they? Yeah, you want a healthy nation as well. After COVID, and we're looking now at people with long COVID, they'll need care and they need to get better. And apparently, a sort of statistic is in the Financial Times that for every pound that if you've got an effective health service, that's £4 into the economy, because you've got a healthy workforce.
Oh, so for every pound you invest in the health workforce, you get £4 into the economy. Yeah. Oh my goodness, I didn't know that.
It makes sense, doesn't it? You've had to take time off because you're poorly, and if you're still waiting for doctor's appointments or whatever, or never mind the fact that as you were saying, if you give nurses money, they actually do spend it as well. It doesn't just disappear; it circulates back round.
And we don't want patients waiting for what they need. We want them to have the absolute best service that they can.
That's true. And you look at the waiting lists recently, and it's getting worse and worse.
But I hope people don't think that it's because we don't care, but it's because we care so much. Yeah, exactly. And it's a huge, huge decision for nurses. Yeah.
So what would you say to any nurses who are listening, who maybe aren't sure how to vote, or maybe they're not a member of the Royal College of Nursing?
If they want to join us, they've got till the 26th of October to join.
To join the
and
Royal
be
College
able
of
to
Nursing.
vote.
Okay.
So our ballot is it started on the 6th of October and it finishes on the 2nd of November. But if they join before the 26th, they will get a ballot. The question that it says on the ballot is, would you strike? And that's the only question. We have done things with work to rule before, but this time it is it is just strike. And no nurse is going to take this lightly. And in fact, when I put my ballot into the post box, I don't know about yourself, Flannery, it was huge. It was like, I can't believe I'm actually doing this.
It was quite an emotional moment.
Yeah, it was
for
a real
you.
emotional moment. Yeah.
Was it the same for you?
For me, it was joyous because I've been advocating, for strike from my first day as a nurse or my first day as a student. The conditions have been appalling for a long time, and I've always wondered why there wasn't strike action sooner. So
you were kind of like, yes, finally people are realising that it doesn't have to be like this.
To take action, otherwise, the situation remains the same forever.
I think if nurses, if they are members and if they want to become members, we have got an industrial action handbook, which they can just, if they just put it into the RCN Royal College of Nursing website, there is a handbook, so it tells you exactly what strike action for nurses would look like, because it will look very different.
Tin, one question?
So we've also heard on the news that the NHS waiting list, so the people waiting for hospital appointments, has hit 7 million for the first time ever, and the government says that this is because of COVID and even because of demographics, so ageing population, that sort of thing. Is that true? Is there a reason that the NHS is failing, or is it just sort of inevitable?
So what happened, interestingly, with COVID, as you know, we just had to turn everything round to COVID, and you wouldn't have got your appointment for your operation, but that's because there was no give in the system anyway. Yep. So there was, even with the Nightingale hospitals that they built, up in Ewey and everything, it'd be hard to have staffed them anyway. Right. But we were all turned around to COVID, so obviously that's had a huge hit on the waiting list. But it wasn't in a great state beforehand. Yep. And I think nurses thought, well, now we'll get the investment that we need, and we'll get more nurses. But what's happened is that people don't want to go into nursing so much anymore. I think it was a third less. Because, of course, when nurses used to have a bursary. Yep. So the students on the ward they're working for free. Well, less than free. They're paying to work.
They're paying to actually be there. Yeah. Oh my goodness.
So because they've gone into to be like other students.
Yeah.
So I think
my cousin she's qualified now, but when she was working she was a midwifery student, and I couldn't believe it because she was basically working pretty much full time, but she was having to pay £9,000 a year, tuition fees for it, So never mind a bursary.
These wonderful students, they did work through COVID with us, didn't they?
Did.
And I think they've decided maybe it's not for us.
Yeah. Oh, goodness. Right, well, thank you very much. Is there anything else you want to say before we wrap up? Thank you so much for coming in. Go on. You're something on your mind, I can tell.
Just, that all the nurses who have not already signed up should sign up, and the public should get behind the workforce as well. And I think we just need as much support from the public as possible.
Yeah, apparently the polls say that 64% of the public support us.
Oh, that's good. So almost 2/3. That's good for you guys that almost 2/3 of the public are supporting you.
Yeah.
Okay.
I mean, we'll see how it goes.
Yeah.
But we will keep the public really well informed about it if we get the mandate.
Okay. Brilliant. Well, thank you so much for coming in, guys. Yeah, really interesting. Good to sort of hear from right on the front lines of the NHS crisis. We're going to play some more music and be back with you with some news at 9:30. Thanks very much. Bye.